So now I invite Dr. Sathyan for his talk on role of advancements in perimetry in today's practice.
Yeah. Thank you, Amit. Very good morning to all of you. I'll just touch upon what are the newer advances in the already existing perimeters, and also what are the newer type of perimeters available in today's practice. So looking at the Octopus, what are the software upgrades is one is on the optic nerve head projection analysis. If you have the Pro version, then you can always see all these things. It is just how we can correlate the anatomical changes, where exactly is going on. We can look at this optic nerve head projection analysis, and we can look for the changes over that place. And not only on the optic nerve head, it has also given the macular map closer to the GCL, how we map the GCL in the OCT pictures. So that's how the macular map is done. These are all kind of an extrapolated data. Then you have the serial analysis, though it is already been existing, but there is a new software upgrade where we can really match. If you want to delete some of that, we can easily delete. The software upgrade has been done. And also when you are looking at the progression analysis, especially on the polar and cluster analysis, they are given the trend analysis for the polar and cluster analysis, which is again an advancement in the software. And also just have a look at this portion, the last portion here. We can always select this one thing which is good in Octopus is we can just select and deselect whichever you feel is not done good. So if you have selected all this, then you can see that as though it's showing that the fields is becoming better. But then you see in this graph, I have selected a different one, and you can obviously see this one is something similar to the theta fast. So I have just deselected, and then you see this the 3-1. These are the three are the G dynamic. Then you can really see what exactly is the progression going on in this. So the other advantage is you have done a 30-2 program or G dynamic program, and if you want to shift it to 10-2, then you just switch it to this mode, and then you can immediately see that how the 10-2 will appear to be. So you don't have to really do a separate 10-2 in this Octopus. Then the other one is something called as a summation. We all know that the binocular visual field how it has to be, but we really don't see how it will be. So this is the binocular summation. From this we can understand how the patient probably will have the field functionality of the field will be for them. So then other test is introduced is the ocular motility test. If you have a patient with say sixth nerve palsy or third nerve palsy, you can always examine the patient's ocular motility completely than what we do with our other charts. So this is other upgrade in the Octopus perimetry. Then looking at the Melbourne rapid visual fields developed by the AppView Technologies. This is a newer perimetry where the patient can do it at home. This has been tested against the basically on the HFA pattern, iPad based test, and you can see that it is a portable device. HFA 24-2 is being clinically validated based on that. Then they have so you can see that this is how the test is being done. I think many of you would have just experienced this in at least in the conference venues. I think they have one here. So the patient has to just touch the screen. They have shown it here. So they just touch it and then it gets recorded, and then you can see the pictures. It is something similar to the HFA pattern. This is how the MRF will appear to be, though it is a little bit different, but the results seems to be the same when you look at the ROC curve, and also the test retest variability also. It is shown to be something correlating very well with the Humphreys. So that is and all the other tests also available, like a glaucoma pattern you can do, neurological test, macular, and the diabetic functions, everything we can do in this. And coming to the Humphreys, what is a new upgrade in the Humphreys is one is on the CETA faster 24-2 program. Then you have a 24-2C where you have the central points, the number of points that have increased so that we don't miss any of the points. And then they have the review software, which is something similar to the Octopus iSuite software, and the automated patient alignment. So these are the newer introductions what they have done. So they say that the CETA fast reach is much more faster than the existing CETA fast program, so which has saved the patient's time and also our time as well. So that is this is the liquid lens where you don't have to really place the trial lens anymore. But I think it is not for all minus or plus whatever. I think it is up to +3 or -3. I am not sure about that actually. So then in Octopus they already given this automatic aligning software. I think the HFA has introduced recently in their new machine. So you really don't have to keep changing the patient head. So alignment is automatically done. And the review software where you can sit in your clinic and then see with the software itself. You don't have to take all the printouts to see how the patient is doing or how the the progression analysis, everything can be seen in your desktop. Coming to the next one is the AVA, that is Advanced Visual Field Analyzer. This again, it has been published by one of our consultants in IJO. So this you can just lie down, do it anywhere. So this is very comfortable. The one advantage is the nose is not covered. The patient feels quite comfortable. Wherever he feels comfortable, he can sit and do the test. And it is something similar to the Humphreys. Again, it gives you the same kind of results. The full threshold testing has been done in the ELISAR perimetry. And coming to the last one is there something called as a AVA, sorry, not AVA. This is the Alphase technology. I think Venkatesh is one part of the upgrading that machine, the analyzer. IVA, there are multiple analyzers have come into the market. So this is again similar to the HFA pattern. Full threshold testing has been done in the same way like others. One is it looks like more of a color coding is also done in this. And similar to that, they have the upgraded versions is Intelligent Vision Analyzer is the last upgrade they have. So these are all some of the upgrades that we have in the current perimeters. I think from LVP also they have introduced one more perimetry, something similar to the HFA printouts. So these are some of the upgrades that we have currently. Probably we can have more questions. Yeah.
Thank you, Dr.